This is part two of the time that I got pregnant while I was already pregnant. So if you're just tuning in, go watch part one and then come back. So at this point, I'm leaving the OB's office thinking that I'm pregnant with one baby and not really sure what to think about the possibility of there ever having been a twin B. I go back to field work the next day. Like I said earlier, I'm trying to finish my doctorate in occupational therapy and I was miserably sick. Like the next day, I started vomiting pretty much all day. I obviously hadn't told anyone at my fieldwork placement that I was pregnant. One, because I was super early, I'm like 6 weeks, but also pregnant occupational therapy students are not protected in fieldwork placements in the same way that pregnant employees are. It's not considered employment. And there are fieldwork placements that do not allow pregnant students. I was almost done with this placement, like 2 weeks away. So I was hoping to wait until the end to tell anyone that I was pregnant. I wanted to make sure I finished. So I go back to fieldwork the next day and I immediately start vomiting. So I vomited before I left that day. I vomited over lunch. I was taking breaks in between patients to vomit in the bathroom. It was awful. I was miserable and trying really hard to hide how bad I felt. The OB had scheduled another appointment for about a week and a half out when I would be almost 8 weeks because they had found a subchorionic hemorrhage at the first appointment. That was the cause of the spotting that I was having. So I made it through the next week with nobody finding out that I was pregnant. If anybody noticed that I wasn't feeling well or asked, I told them that I had a UTI and I was on an antibiotic. I was just trying to get to the end and I was miserable. So another week or so goes by and I go back to the OB and the spotting has stopped at this point. So we have another ultrasound. Since the spotting's gone, I'm expecting just to see one healthy baby. The ultrasound tech starts doing an external ultrasound and then she gets a look on her face. Of course, this was pretty much prime COVID and so we all had masks on, so I couldn't read her face very well, but she says, I'd like to switch to an internal. You can just see a lot better that way. And so she steps out of the room so I can take my pants off. So the ultrasound tech comes back into the room. She completes the internal ultrasound. Everything's good. She shows us the baby. We see the heartbeat. And then she says, and do you remember that second sac? And I said, shit.